Prosperity in Black America. What will this require? Is Black business prospering? Are we reaching women and minority-owned businesses? How do we achieve earning parity for wealth for our families? Do our children really have access to education? Will our families have choices for our children? Prison pipelines, mass incarceration, tearing our families apart. A healthcare system not accessible to the masses. The disproportionate termination of Black women from corporate America. When will we actually begin to address what's really at play? How do Black people gain more power to help make these changes? This requires a lot of political will and courage. I'm that provocateur of change. I am Cindi Bright. Welcome to HeartBeat. Good evening, everyone. Welcome to HeartBeat this evening. Glad to have you join us. We're excited for a good conversation this evening. I mentioned last week that starting this week, we are going to be hosting many of our elected officials who serve in the legislature to be on with us and talk with us. Last Thursday, legislation session ended. And so we're beginning that process of hosting some of these conversations every week, or as often as we can get some of these elected officials. And we're also paying attention to who is filing to run for office, because we are interested as a community to see and understand and know who the people are that represent us. Now, let me say a couple things here. One is, you've heard me say this before, and I don't know if you're actually following the news, what's going on politically at the national level. So if you're following Don Lemon and what's going on with him, you know, he was terminated from CNN and they paid out his contract and he's now launching on his own. And, you know, one of the things that his show launches on Monday, and he has put his show, or was attempting to put his show on X, the former Twitter thing. And so his first conversation is with Elon Musk, but Elon Musk got angry after the conversation and decided that he didn't want Don Lemon to share his show on X anymore. The reason I bring that up is because HeartBeat is on my Cindi Bright's platforms also. And I think it's incredibly important that the conversations that we have with elected officials and people coming on can come on and have open conversations and not be controlled by what I'll call typical media. And what that also means for me personally is the people that I am selecting to bring onto HeartBeat to have conversations are, from my perspective, the people that are living the values that we need to have from people that are in elected positions. In other words, when I bring on the guest we have on tonight is Senator Patty Kuderer. Senator Kuderer is out of the 48th district. It's Bellevue, Kirkland, Redmond. She is running for the position of insurance commissioner. I intentionally am not bringing on her opponents. And the reason I'm not doing that, typical media would say, you know, let's just bring on all of the candidates and let's do a candidate forum and all that sort of stuff and hear different things. Oh, that's well and good. What I'm trying to do is focus on people who have demonstrated the values of focusing on advancement of Black America and women and issues that we need, that we know that these folks are actually doing something. And I have followed her record and followed her for several years. And so hence why she was invited onto HeartBeat this evening. Before we introduce her in, we have our commentators with us here. Let's welcome in Dr. Karen Johnson, known as Dr. J. Good evening, Dr. J. We have Erin Jones, who's here every week with us here. Hey, Erin. And we have Dr. Stefani Coverson coming on with us. So we just have, the first half of the show with Senator Kuderer. Let's invite Senator Kuderer in and welcome her back to HeartBeat. She has been on HeartBeat a few times before, and happy to host a conversation with her about her decision to run for the insurance commissioner position. I may be speaking out of turn here, Senator Kuderer, but I think many people don't even know that this position exists in the state. And so maybe you could just introduce yourself, your background, not just your educational background, some of your accomplishments that you have accomplished since being a state senator, and then talk to us about what the insurance commissioner position is and why you decided to run for it.
Well, thank you, Cindi, for inviting me on, and it's good to see everyone. Thanks so much. The reason I think that a lot of people haven't heard about the insurance commissioner's office is because it really hasn't been in any kind of contest for well over 2 decades. We've had the same insurance commissioner coming up on 24 years. So that's one of the reasons. I think the other reason is that there hasn't been a lot of community outreach. But I do think that will change, especially if I get in there, because I know that the obligation of the insurance commissioner is not just to regulate and provide oversight of the insurance industry, but it's also to be a consumer advocate. And that's part of my background. I am a trial attorney by training, and I've been in the legislature since 2015. I was appointed to the House of Representatives, served 1 year in the House in 2016, and then was appointed to the Senate. And I've been in that role ever since. And in that role, I focused a lot on social justice issues. Housing issues have been huge. It was my bill that created the right to counsel statewide in Washington. We're the first in the country to do that. And based on the data that we've gotten back, it's already showing us that it's working and it's keeping people housed. I also had the bill that eliminated Tim Eyman's advisory votes. And like I say, I can die a happy woman now. I just could not stand having waste, fraud, and abuse right up front and center on our ballots. And I am really grateful that they are gone. Finally, after 10 years, I call it a failed experiment for sure. We've replaced it with the ability for voters to go get accurate information about where the budget dollars are going. It's on a website, and it'll also be in the voters pamphlet. You probably noticed the voters pamphlet this year was much thinner than it has been in the past. And the reason is, quite frankly, because we got rid of those ridiculous advisory votes. I also had a big bill this year dealing with pharmacy benefit managers, and that's the healthcare piece that is so really driven me to want this position, to have the insurance commissioner position. And, this goes back to when my daughter was born about 30 years ago now. She was a micro preemie. She was, pound 13 ounces and spent 5 months in the hospital, was critically ill that entire time, had 3 surgeries. And during that time, the insurance company a couple times denied her care, denied paying for it. And as a trial lawyer, I had already sued insurance companies by that point. I'd represented some too, quite frankly. And so I kind of knew which buttons to push. But I have to tell you that it really angered me to leave her incubator, to have to go fight for this life-saving care that her doctor said she needed, that some bureaucrat in an insurance company was denying. And I also thought they had to be doing that to the other parents who were in the NICU with me. When I brought her home, there was a letter from the insurance company telling me that she had nearly reached her lifetime cap. I mean, she was 5 months old. And what that said to me is that we have a morally bankrupt healthcare system. And I know we can do better. I know for me, it's not a question of if we have universal healthcare, it's when and how. And I'm going to dedicate resources in the commissioner's office to making sure that can happen. Because the insurance commissioner's office will be charged with implementing the healthcare laws that we pass. In addition to that, for example, we're going to be in charge of making sure our reproductive justice bills that we passed in the wake of the Dobbs decision, that they are fully implemented and people have access to reproductive care in this state. And I will definitely be on top of that. And there are other things too, long-term care, auto, homeowners, especially as that relates to climate change. And we can talk about that, but that's really kind of the main reasons why I want this position and why I feel it's time for me to move on. And just a couple of the things that I've gotten done. I have a few more bills that I'd like to talk about, but we all like to talk about our babies, right? And I've got a few, so.
Yes, awesome. I'm going to let the team chime in and ask questions.
Hi, Senator Kuderer, Dr. J. It's so good to see you again.
It's
I
good to
thoroughly
see you.
enjoyed working with you in my former position.
Yes.
And speaking of which, so I pulled out that policy brief from December 2020 that talked about the establishment of the Washington State Office of Equity, where I had the opportunity to meet you when I was its inaugural director. And at the time, uh, there was some thinking around passing legislation that banned the use of credit scores. And I'm going to read specifically bans the use of credit scoring in the auto, homeowner, renter, and boat insurance. Why? Because those credit-based insurance scores historically and disproportionately affected communities of color and low-income communities because of inequities embedded in our credit system. Could you just talk to us a little bit about your thoughts about that and just something that you might want to put forward or not?
Yeah. Thank you. Well, the research does say what you said. It shows that there really is no connection, and so credit scores are being used to increase premiums. The current insurance commissioner actually did try to implement by rule a ban on using credit scores. But the process that was used was determined to be faulty, and so it was voided, and he didn't pick that up again. It is definitely something I'm going to be looking at, in addition to other things, Dr. J. For example, with the auto insurance, and this particularly impacts our BIPOC community members. A lot of them, they're going to 6-month auto insurance policies. Now, way back, I've actually been an insurance agent in a former life, and we never sold 6-month auto policies unless it was super high risk. But what we're seeing is more and more 6-month policies, and that gives insurance companies the ability to increase the premium now twice a year as opposed to once. And that really does impact working families. That's another thing I'm going to be looking at very closely. So why the need for 6 months, and thinking about giving them extra time to find additional a new insurer when they have a non-renewal notice issued for them. I did have a bill this year that passed that extended the time for homeowners, but we weren't able to include auto insurance in that particular bill. But it's definitely something I'm going to be looking at. So yeah, it's going to be on the radar. Thank you.
So I have a question, just as somebody who also ran for an executive role. Part of the reason I ran for OSPI was not that I wanted to be a politician, but I wanted to really leverage that role to use as a bully pulpit, because what I knew about OSPI is we didn't actually get to write law or change policy. We got to interpret and implement. And I'm curious with the insurance commissioner, how you are able to use that role as an advocate, because that person has been really silent. We haven't heard about that person. It seems like they're just kind of in the background as a bureaucrat. How do you kind of reinterpret that role and use it in a way that really can bring flourishing to more people in the state of Washington?
Yeah, thanks, Erin. I would say this. I have a lot of relationships in the legislature, and the Office of the Insurance Commissioner, like any other office, has the ability to have agency request legislation. That doesn't guarantee that it's going to pass, but it does mean that you have the heft and the gravitas of the commission's name behind the bill that you want to get passed. You have to have a legislator who's willing to prime it, of course. But I think that's where my relationships with my colleagues come into play. They know I'm a serious legislator. They know I do my homework. They know I don't, they know that I stakeholder things really, really well. And I think that all of those things bode well for if I have agency request legislation, that I'm going to be able to find someone to help shepherd it through the legislative process. And I know that the legislative process is designed for things to fail. But, my PBM bill, for example, it took me 7 years to finally get that over the finish line. And that was a strong bipartisan bill. But there were so many hurdles, and the headwinds were so ferocious to stop that bill because it was very consumer oriented, which is how I really view the commission to be, right? Washington is one of like a dozen states that actually elects their insurance commissioner. Everybody else is appointed. But that means that in our state, the insurance commissioner is accountable to the people, not to just one person. And in our statute, even, aside from the oversight and regulatory function, which is a primary function, the other primary function is to be a consumer advocate. It says that you're supposed to be acting in the public's interest. And I think too often times I think statewide offices can get stuck in Olympia and they don't go around the state and they don't reach out to people. They don't let them know what resources are available to help people all over the state. And quite honestly, the insurance commissioner's office has a very robust complaint department. It has its own litigation department. That I think can provide a resource to people who are experiencing a claim denial or insurance issues that can step in and take a look at what's going on to see in what way can the insurance commissioner's office be of assistance in solving that problem. And I do think it's important to go around the state and let people know about this. Now, right now, I do think that's a particular, they're way behind in complaints. They've seen just a mushroom of complaints, and a lot of them are in regards to HealthCare. So I think it's something that I want people to understand, that we'll have more training. I think I want to take a look at how that process works differently in the commission when I get in there, so it becomes more consumer active.
Thank you.
Awesome.
So, speaking of healthcare, I want to ask a question around mental health care, particularly for BIPOC folks and folks in the LGBTQ community. So I know a few years back, insurance companies had to start treating mental health services or provide the same levels of service coverage for mental health care that they provided for physical health care. But what I am hearing, that's wonderful. And the folks from those communities seeking culturally affirming care or gender affirming care, the administrative burden to either become a contractor for an insurance company to be a preferred provider, or just the administrative barrier for processing these claims, it's really difficult for BIPOC therapists and therapists that provide gender affirming care in the LGBTQ community to even break into that. And so then you have folks in these workplaces, which we talk a lot about every week, the need for self-care and to get therapy, as we're navigating toxic workplaces or just toxic national discourse about our rights to exist. What can the insurance commissioner's office do to support these smaller therapist practices, or even practices of color or LGBTQ supportive practices, because we are not getting access to the care that we need, despite these rules now saying that physical health and mental health have to be covered at the same rates?
Yeah, that's a huge problem. Network adequacy is a big, big part of the problem. And trying to get people to go into mental health counseling is also a big part of the issue. It's pay. I mean, a lot of it does come down to reimbursement in order to have sufficient mental health counselors out there. And I know when in my time in the legislature, I've been very vocal about wanting to increase the Medicaid rate to be on par with Medicare. And I'm certainly not alone in that. But all roads lead back to our tax structure. And quite frankly, it would break the bank if we did that. And, it's another reason why Washington needs to, understand that with every issue that we deal with, that we have to be focused on writing our tax structure as well. And when I say writing, I mean that with just the R. We need to right the ship. I mean, it is really upside down. But we need to have network adequacy. So what can the insurance commissioner's office do there? Well, the insurance commissioner's office is charged with making sure that there is network adequacy so that people do have access to healthcare. I don't know all of the ins and outs of that yet, Stephanie, but I can tell you that it will be something that I will be focused on because I believe so strongly that healthcare is so important. When you talk about the fact that it actually took till the year 2000, with the Mental Health Parity Act at the federal level, when we first decided that mental health issues should be treated in the same way that physical health, because it's mind, body, spirit, right? It's all connected. And I do think that it should be part of every healthcare policy is that people should have access to mental health resources. And we also, we've done a lot of work with telemedicine, which I know, I have relatives who actually will see a counselor on Zoom and things like that. So we're trying to create network adequacy through using remote technology. And how well that works depends on what kind of medication you're on and how often you need to have therapy, et cetera. What exactly is your mental health condition? All of those things come into play when you're talking about whether something should be remote or not. That's why when I see that there are some companies that have been mandating remote therapy sessions only, and they want to pay less for that, I don't agree with that.
Mm-hmm.
I think that it needs to be up to the doctor and the patient to make those calls. Mm-hmm. The other thing about that, and this is where typically with mental health, it can with mental health conditions, you're going to need some medicine sometimes. And one of the things that we have noticed is that the health plans, in conjunction with the pharmacy benefit managers, change the formularies, the drug formularies, what drug will be in their formulary that they pay for, and what they won't. And the way that they have been making the choices of what drugs go on the formulary is how much money goes into their pocket. And part of that has been addressed in the bill that we just passed, and which is why we had such ferocious winds fighting us on that bill. But I can tell you that is a really dangerous thing when they just can change a formulary, especially when you're talking about mental health drugs, because every individual is so unique. And when they get something that works for them and is working for them, it's dangerous to change the drug and just, have them go generic or whatever they want. The next drug they want to put them on where the PBM makes more money off it. That's something that the insurance commissioner's office can definitely be investigating and looking at. And that's, it will be a priority. Like I said, healthcare will be a priority once I'm in there.
Thank you. Just a quick follow-up question. So does the insurance commissioner's office, I know you mentioned Medicaid, but does the insurance commissioner's office have purview over the insurance company's services to private employers?
Some, not all.
Okay.
If a private employer is self-funded, the answer is no. But if they use a state-regulated plan, the answer is yes.
Senator Kuderer, final question I wanted to ask of you, because we appreciate you coming on and making this time for us this evening. I know I wanted to ask you about the skyrocketing insurance premiums for what the consumers have faced post-COVID. And I also wanted to ask you about the reimbursable rates to doctors because of the doctors that are forced to have 2-minute doctor appointments in order to see X amount of patients per day. And I think the reimbursement rates are driving that. Do you have perspective about, should you win the seat, about something that can be done? Maybe that's why Stephanie just asked what she did about the purview over private employers, but to normalize or whatever that is, level set premiums for consumers. And then what can be done about reimbursement rates for doctors so that we can get adequate care from our doctors?
Yeah, I mean, it's one of those things, Cindi, where I'd have to get in there to kind of see exactly what can be done and, what are the premiums that are going up. There's all different kinds of insurances. And quite frankly, right now in property casualty, it's a very hard insurance market right now. And we're seeing property casualty premiums go up. Interestingly, I just read an article today about how, the vehicles that we drive are equipped with internet applications that are tracking how we operate our vehicle, and the auto companies are selling that data to our insurance companies, and premiums are going up as a result of that. That's something I want to look at, because I don't think when you buy a car, you have an expectation that data like that from your car you're just driving around is going to be sold to your insurance company for purposes of setting your premium. So there are a lot of things that we're going to have to look at when it comes to premiums. I know the insurance commissioner's office does approve rates and forms, and that's all based on actuarial science. And there are actuaries at the insurance commissioner's office, and of course, insurance companies have them as well. So all of that, I'm going to be relying a lot on the highly qualified and competent staff that we have when it comes to taking advice about rates and premiums and things like that. But I can tell you that I do know that that we need to get back to insuring the actual risk and not what an insurance company may feel is a general risk. And I can tell you, the example I would give you is I had a call from a constituent who had the same company for many decades, and all of a sudden got a non-renewal notice because they felt that she was a fire risk. Her home was a fire risk. And they didn't go out and look to see what she had done to mitigate that risk. They just determined that because she had a certain kind of roof, a shake roof, that she was going to be a fire risk, and they were going to increase her and not renew her policy. Mm-hmm. Things like that has to end. I mean, using an algorithm, using photo estimates, they work to some extent, but the reality is sometimes you got to have boots on the ground and actually look at the risk. And that's, I think, what's fair to consumers. And that's really what I want to bring to the insurance commissioner's office is, the reason I think that the statute says that the commissioner should be a consumer advocate is that there's an inherent power imbalance between insurance companies and insureds. Mm-hmm. And I think this is a way of kind of leveling the playing field a little bit for the consumer. And I'll leave you with this. The insurance industry wrote about this race and me in particular, and the head of the insurance council here in the state made a point of saying, well, she's said very publicly that she intends to be, an advocate for the consumer. And I thought, well, yeah, I really do. That's exactly what I intend to be, because they don't need advocates on their side. They've got plenty, and they have lots of money, and they have lots of power, and they have lots of lobbyists in Olympia. The consumer doesn't have a lot of people on their side down in Olympia, and I think they need more. And that's what I view my role as being, should I be elected. So thank you so much for having me on.
Yeah, we really appreciate, I think I speak on behalf of the Dr. J, Erin, and Stephanie. We really appreciate you coming on and being an advocate for the consumer. Number one, I think the largest part of our audience are, well, it's consumers here in Washington State, and advocacy is necessary. And so we thank you. Is there a website that you want for people to donate to your campaign? Or how do they find out more or get in contact with you?
Yeah, thank you. They can go to www.pattykuderer.com. And my email is info@pattykuderer.com. And if you say that 17 times in a row, it'll start to roll off your tongue.
All right. We appreciate that. Thank you, Senator Kuderer, for coming on today. We appreciate having you.
Thank you. It's good to see all of you.
All right. I was glad to have her. Those were great questions, great conversation to have with her. And I was sitting here excited about this is why we do HeartBeat, right? Like we get to ask some of these harder questions and we get to see the people that we are electing and decide who we want to keep in office and who we don't. And so, what were y'all's thoughts about the conversation?
I think the thing I appreciate most, especially because I'm traveling the state, is there are so few state executives who are traveling the state. I am, people say this to me all the time. Oh my gosh, you're everywhere. I'm like, yeah, that's where our state elected officials should be, is everywhere. And I get that so much of the work happens in Olympia, but I think it's so easy to get stuck in Olympia, and that's not where the work happens. And I know, having sat on the cabinet for our state superintendent, our previous state superintendent, that what can end up happening is people get hired to sit on their staff too, and Dr. J can speak to this, who also live in Olympia. So not only do you have the executive person who's only in Olympia, the people serving that executive are also people who are from that region or maybe like one town away. And so what can end up happening, without even with good intention, is you end up in this little box, this echo chamber of people who all live in the same place. They don't understand, like where Stefani is down in the southwest corner. They don't understand the southeast. I was just in Walla Walla last week. People have no idea what's happening in Walla Walla. Nobody has any context for Walla Walla. Folks who work in Olympia don't know Spokane very well. They don't know the Tri-Cities very well. They don't know up Blaine and Arlington and all of that. And so it was really refreshing to hear from her that she has this intention to be more present outside of Olympia.
Mm-hmm.
Mm-hmm. Mm-hmm. You know, having had the pleasure of working with her, I'm pleased that she is still focused on consumer advocacy and access.
Mm-hmm.
You know, when she was answering Doc Coverson's question, it was clear that she was not reading from any talking points or any script. It came from her heart. And I don't know who's running against her, yet, you know, if they're not public servants and don't have that consumer advocacy piece, they don't deserve my vote, because it's going to be so important to have someone leading the insurance commission who puts public first in public service and keeps service ever present in public service.
Mm-hmm.
And she communicated that, I think, this evening.
Mm-hmm. Did you have any thoughts, Stephanie? Or are you frozen? I think her screen looks frozen. She might be frozen. Yeah, no, I appreciated that too, because I think most people, I think I said, I didn't know if I was speaking out of turn, but most people don't even know that position exists and what the function of it is. Like, and you know, when she talked about, you know, there's several things she said to me when I prepped with her for this. She talked a lot about, she didn't talk about it on air necessarily, but about this whole appeals process, because so many people's claims and things that they were fighting for were just getting denied or thrown in a bin. And I think she referenced the fact that they're backlogged on complaints. And so, you know, she wants to simplify that, because in my words, how I heard her explain it to me a couple nights ago was that it's almost as if they're just wishing people would go away, right? You make the process so complicated that no one has the energy or time to try to navigate it. And she wants to simplify for the consumer how to have its access, right? What you were saying, Dr. J. And so I just think so important that people think like that, and that we can get elected people elected into these positions that are actually fighters for that's what they're elected for, right? Is to look out for the people. So, yeah. Stephanie, you had frozen up for a second. I wanted to give you an opportunity to just put your thoughts out there too.
I really appreciated the senator coming on, particularly I take note of elected officials and candidates who have the courage to come to speak with communities of color, particularly the Black community, and news and talk organizations that center around issues pertaining to us and our well-being, our wishes, our hopes, our dreams. And for me, that is particularly important because I continue to kind of feel a sense of entitlement every 2 and 4 years, as opposed to let me come hear from the people and earn your vote and tell you what I've been doing or we've been doing to respond to what you said is important. So I really appreciate her coming to the show and speaking with us. And then one thing that she said in particular was figuring out this like universal healthcare. And I am reading a book right now called Plantation Theory. And it talks about basically how, corporations and workplaces are, the present day plantations. And not just for Black folks and people of color, but all working folks that have an employer. And that especially filled me up with some hope, right? Because the tether to the corporate plantation is healthcare. Like, who can afford $700, $800, $900, $1,000 a month for individual or even family healthcare, depending on your age? And it is just my hope, because, well, first of all, healthcare should be a human right. It should be just a right. We pay enough tax dollars for that to be the case. But secondarily, healthcare is what keeps many of us as Black women tethered to these corporate plantations, dealing with this toxicity every day. So I really appreciate Senator Kuderer keeping that kind of at front of mind, the importance of universal health care.
Yeah, I thought so too. And you're right about premiums. I don't even know what it costs for a family. I know what I pay as an individual, and it's at $1,000 a month. And to your point, who can afford any of it, right? Yeah.
Tethered to corporate plantations while dealing with the toxicity. This is, I can't let that go. You just try to get Dr. J riled up because, I just left the healthcare authority yesterday to have them disenroll me from the medical COBRA coverage because I can't afford it at the moment. I just can't. So thank God I'm a woman of faith and believe in divine health and divine healing to carry me through. However, this is critical. This is critical. Both my grandmother's hands, as well as Dr. Joy DeGrew's post-traumatic slave syndrome, really talk about the impact on our bodies, spirit, soul, and body, quite truthfully, mind, will, and emotions, dealing with, as you put it, the toxicity. And I, too, was very pleased to hear the senator talk about writing this system around universal healthcare would be one way to deal with getting treated. However, what do we do to even prevent this in the first place? We often talk about the focus on self-care and resilience is important. Yes, it is. However, why don't we just get rid of the toxicity? And I'm concerned that if we don't get healed, we're going to continue to pass the trauma onto other generations. And there comes a time when we have to say enough is enough. And I believe that we are at that time, and it is time to get untethered from the corporate plantations and start dealing with the toxicity. Understanding, though, that as we deal with that toxicity, shielding others from it, we also become the target of it. And I am particularly glad, hope that this her consumer advocacy begins to bring in these healthcare providers of color, LGBTQ provider. There was a pharmaceutical that they needed that wasn't even on the formulary, and the costs are exorbitant. So perhaps this is something, maybe we can bring her back. I would hope to bring her back after she wins. I'm being optimistic, or even if she doesn't, to kind of talk about what we could do to make sure that those things are advanced.
You know, Dr. J, you were mentioning something just about the toxicity that gets passed on down. And I teach 2 online classes on Monday night and Friday night. And I've been in 2 different locations. I'm not going to mention them because I know there are people watching and I don't want to call them out. But I was in 2 different places over the last 5 days where there were Black educators working in really toxic school environments. One in Washington State, one in San Diego. The San Diego region, a lot of people think of Washington State and California as really progressive, but the reality is, unless you're in specific places, they're not progressive in a lot of ways. And I had the opportunity to spend significant time with 2 groups of educators where they are some of the only in their entire districts. And they talked about the toxicity of being in those spaces. And one of the conversations we had in class this week is, at what point as a Black educator do you step away from that space in order to protect yourself and the students? So I think a lot of times we stay, I'll say for myself, I stayed in spaces longer than I should have. And the message it sent to children and to my colleagues is that it's okay to be abused. And that ends up perpetuating the cycle of abuse. Right. And so the conversation we had in class this week and last Friday was, you know, at what point we can't be the savior as an individual person. We can't be the savior of the few Black and brown people in our community. And at what point do you step away and take your children out of a space that's really toxic? And your comment just reminded me of that. And you know, it's also connected to the reason I can be an independent business owner is because my husband's a teacher and has great insurance. Otherwise, I couldn't be doing what I do because we couldn't afford the insurance.
Right. And sometimes, because I think that the civil rights movement has been very romanticized, right? So you stick it in, you keep going until the end because that is what our ancestors did. And look what happened. We got this whole, Civil Rights Act of 1964. And of course, Dr. Derek Bell blew it all open with convergence theory when he broke down the alignment. It really wasn't just about the protest. It was also some things that our government and elite white folks in power wanted to see happen on the global stage and domestically. So yes, like resilience is self-care and mindfulness and taking time for self. But resilience is also speaking truth to power. It's also establishing and sticking to your boundaries. It is also filing that grievance. It is also contacting the EEOC, like all of those things. And sometimes resilience is also having the wisdom to walk away, right? Because you are being harmed. And particularly in academia, like Black women are dying, right? And I still think about, the fourth quarter of 2023 and sort of rolling into this first quarter of 2024. We've had Black women presidents of colleges, vice presidents die, like untimely deaths, die.
Lieutenant Governor,
Lieutenant Governor, Yeah, yeah. And I'm thinking about the
Dr. Candia
personal
Bailey.
impact. Yes,
Would you say?
yes,
Dr. Candia Bailey, the
Oh,
yeah,
vice president who took her life.
yeah. Dying by suicide from, you know,
Abuse.
due to the abuse that she documented in emails to both the president and the board, and, did not get any relief there. I also think about the president that passed away at an event at Temple,
mm-hmm,
right? And the event continued
mm-hmm,
um, after, she was taken to the hospital.
mm-hmm.
And no job is worth it. No job is worth that. And so I wonder about building for ourselves, right? So building the table for ourselves. Like, why should I have to bring a folding chair when I can build a table for myself and be in community and collaboration with women like y'all, right? And we're building something together. So, yeah, that's
It
what I'm
reminds
thinking about.
me. I had the opportunity to meet Angela Davis in 2013. She came to Federal Way School District and spoke, and then she spoke the next day at Seattle University, and she invited me to come hear her again. And I'll never forget, I asked her if you could go back and tell your 30-year-old self anything different about how you responded during the civil rights movement. She said, Erin, I would have told myself to rest, that it's okay to just not work, and that I actually need to just sleep and step away, that I don't need to be running all the time. And that was so, for me, like revolutionary. And so, I just think about what you just said, Stefani, and the ways that we have been taught by our ancestors and by history and by America to just go, go, go. And we have to be fighting all the time and every day and every moment. And if you stop, you're lazy. Instead of, Angela Davis, who's the queen of the work, saying, yeah, absolutely, rest.
Mm-hmm.
And I tell people my greatest act of resistance is rest now. It's taking a nap. It's like, I love the nap ministry. We talked about that in a past episode, but really choosing to set boundaries. Like, you don't get my time right now. You person there who are asking me questions, no, I'm going to say no to you. You don't get my time. You have demonstrated you don't listen to me anyway. So setting some boundaries and then taking a nap when I'm tired and saying, no, I'm not doing any more today. And that's not lazy. That's just saying my physical body, my emotional self is done today, and just saying no. And that is an incredible act of resistance. Yeah, I love that.
It is.
You
It
know,
is. I was sorry. Go ahead.
No, you can go ahead, Stephanie.
Really quickly, I was talking to a group of girlfriends who I have worked with in different spaces over the years, and we were talking about how we all seem to shut our offices down like it was the club, like we were the ones to turn off the lights for the whole department, and leave. And you would have people that same position, title wise, peers that are like, oh, it's 4:30, gotta go. And here we are. Right. In the minute, that we're like, oh yeah, we're going to leave at 4:30, or we're going to leave at 5:00 too. Like, that was not received well.
Mm-hmm.
Right. So this expectation, I think, to in part constantly be the work mule, because, got to work twice as hard to get half the credit. And then also we're perceived as the cleaners. So a lot of times when we get into these executive positions, it is because there is this whole road of chaos and dumpster fires and waste paper basket fires and junkyard fires. And then they're like, oh yeah, let's hire a Black woman. Like, they're smart. And we get into these positions, and even though they gave our predecessor like 7, 12, 13 years to set all these dumpster fires, the expectation is that we extinguish the dumpster fire and turn it around and make it sustainable and green, all these, remove all the toxins, but don't take it to the junkyard because that's not sustainable. Like, we're expected to do all of these things.
Mhm.
Right. And we are dying from doing all of those things. So, like, rest is resistance because we are always and still expected to be the work mule. And I have yet to hear from too many women of color, but Black women in particular, saying that, oh, no, I don't feel like a work mule. In fact, I feel that the work is distributed equitably. I am heard and I am valued, for all of my expertise. I'm not hearing that.
Right.
I'm hearing about a lot of doctor's appointments, though, and therapy appointments, and rest as resistance. Sorry.
And we should, I want to say something, and then I want to go back to a comment that Dr. J brought up earlier in the show. I want it to be clear as you're talking about the trash can burning, and we're always expected to fix stuff. That is not just major companies. I'm just gonna talk a little bit cryptic here. But I encourage, our audience, things are not always as they appear. And so when you look at where each one of us have spent our time professionally, whether it be in organizations, whether it be in small businesses, when you look at what we're brought in to do, and then how quickly we depart, we are still expected, and I would just say from our own kind, to fix problems instantaneously when there's no support to do that. There's no money to pay people. They don't provide resources. They don't have anything to give us to be successful. And then they bad talk us to other people in the community while we take the high road and not say anything or disparage their names, because they are also Black businesses in this community as well. And so we need to pay attention to what's happening, and start to learn to read between the lines of what's happening to Black women, because, I've had to make some decisions here recently to walk away also, because I can't fix stuff that other people created, and you don't equip me to solve problems. You expect me to bring in all this money and help you have money, but you don't even pay the people that are working for you. So, these are real issues that us as Black women have to deal with. And so us staying out on our own, I mean, all four of us here are not tethered to a company right now to abuse us. Dr. J, I want to come back to something you said actually in the intro of the show, because I'm bringing it back to the insurance commissioner here before we close out. When you asked the question about the credit scores, right? Like the systems that I had no idea. And then when Senator Kuderer talked about data being shared and premiums, and then I also had no idea that insurance companies were doing 6-month policies in order to jack rates up really quick. Like this entire system, as we talked about it tonight, it is another intentional design to harm communities of color. Just to hear all of that, right? Like that we're at risk, and that you can't afford to continue on with Cobra because you can't. I mean, this is the vicious cycle we're talking about. And so, back to our elected officials and why it's so important to have the right people in who are consumer advocates and who are going to help. I didn't ask her how long of a seat that is. Do you know, Dr. J, is that a 4-year seat? I don't know either. How do you know, Erin, how long of a seat that is as well? We have to hope, because Senator Kuderer is known to be I'll just say balls buster to go up against and push hard and drive for change. And she's out of Bellevue, the district she referenced, the people who in her district, if 5 people paid their fair share of taxes, it would fix the problem across the state. This is just an important thing. And I want to close out with our, kind of our thoughts about going forward on elected officials and issues that are of vital importance to us as communities of color and as women, what we need to have and what we're looking for in the people that are that are re-signing up to get into new roles or re-signing up for this next year is the Senate and House. I think the Senate, maybe it's only the House representatives that are, actually it is only the House, right, that are running for 2-year seats this year. I don't remember offhand. What are your all's final thoughts about this particular issue around making sure we get, it's every 4 years. Thank you for that. The proper people into these seats, and what can we do as, the hosts here, and what can our audience do to help advocate or help make this happen for us to change this trajectory? Any final thoughts from you all?
I just think people need to vote, and they need to vote on more than just president and governor. They need to vote on all the things. And I understand having run for office and having not really been actively engaged before I ran for office. I get that it takes time to figure out who to vote for and all of that. And there are really great organizations that can give you a rundown. Like, at least read their descriptions in your voter pamphlet. Like, at least do that the day before. Like, if you do nothing else, but vote. And you need to vote on everybody. And here's the recommendation that I would make to the people out there who are not politically engaged. And no shame to you. Just start. Get politically engaged, because it's going to matter. It absolutely matters for you. But follow some people, like figure out, who do you really care about? Like, is there anyone on this screen that you really trust our voices? See who we're promoting. See who we're lifting up. See who we're endorsing and supporting. If you have other elected officials that you trust, go to their websites, go to their Facebook pages, go to their Instagram, see who it. Reach out to me. I have people reach out to me all the time. I got to pray in the House of Representatives last Wednesday. And what was so awesome is the number of people who came and said, Erin, there are people running for OSPI. Who do you recommend? People trust me on that issue. And so they come and ask. Reach out to us. If you want to know, hey, Erin, what do you know about this particular candidate? I will be honest with you, because I do know a lot of the candidates. Reach out to people that you trust if you're not sure. Because people can write whatever they want to in the voters pamphlet. You might not want to just trust that, but don't hesitate to reach out to people that you trust and ask for our opinion. I will give you my honest opinion. I won't tell you vote for this person. I'll say, here's why I'm voting and supporting this particular person.
Yes, I appreciate that. Before Stefani and Dr. J, let me just add a little bit to what you just said, Erin, only because I'm going to reference Senator Kuderer's run for the insurance commissioner. If she wins that election, and this is of particular importance to those of you who live in the 48th district, what that means is that Senator Kuderer would exit her seat as the senator, and her Senate seat is a 4-year seat. And so she would only have completed 2 of the 4 years in that Senate seat, which means her seat opens up for an appointment process, which means the district can appoint someone to fulfill her final 2 years. Why this is so important, particularly to those of us of color and to those who live in the 48th district, is I already know 3 candidates in the 48th who want Senator Kuderer's seat. One of them currently serves as an elected official. And so what you have to do is look at those elected officials' track records and see if they have in fact done anything that supports us and our community, because I could make some strong arguments. So to Erin's point, if anybody wants any insight and wants to call and talk to me about it, but we have to make sure that that's the easy entry, and how many white folks get into these positions of power is that they get appointed in, and then once they get the name recognition, you can't unseat them, or it's very difficult to unseat them, I should say. So very important to Erin's point, get politically active, become a precinct committee officer in your district so that you have voting power on who gets moved forward into these appointment processes. I took more time than I should have. Stefani, I wanted to hear from you and Dr. J on closing thoughts before we finish this evening.
So yes to everything that has been said previously. I would add that it doesn't stop at voting, right? So what tends to happen is, we rally around candidates, elect them into office, and then we don't hold their feet to the fire. We don't follow up, right? We don't write, we don't say yes to this, no to that. And the people that did not vote for them, or the people that, were not necessarily participants in that campaign, or getting those folks elected into office, are the ones that are showing up in that person's office.
Mm-hmm.
Right. And so then they start having the listening ear. So the other part to this is vote, and you have to follow up to hold folks' feet to the fire. The other thing that I would say, now I have 2 degrees in political science, so that is kind of my first love and background. And what I think is really shameful and sad is that I believe very intentionally by design, civics classes, we don't have civics classes anymore. So sometimes when, maybe we're upset with the governor about something and it's really the legislature that didn't pass the thing because the governor is, the person that executes, whatever has been moved through, the legislature or Congress. And so getting really clear about, the branches of government and who has responsibility for what, because the misinformation of, throwing people under the bus for different things that they don't have power to do pisses us off, right? If we're not aware, like, oh, that's not, the judiciary, that's, the legislative body, and then turn around and be mad at the person that's spreading out the misinformation and playing in our faces.
Mm-hmm. Mm-hmm. Well said, Stefani. Thank you for that. Dr. J.
So that in summary, I would just add to all of that, in this day of democracy versus autocracy, rest, reset, refocus, and relaunch, because your very life might depend on it.
Mm-hmm. Very powerful. Thank you for that. Thank you all for joining tonight. This was this is why, I've had moments where I think, oh, I've been 6 years doing this. Have I done enough? And then I have a show like tonight and I'm like, got to keep going, right? It's just so powerful to help our constituents and our audience to, if they're not learning, I learn something every week as well. So we learn something by having these conversations. So thank you, ladies, for joining me this evening. And to our audience who joined this evening, thank you for joining us this evening and being on this journey with us. Next week, the topic of the show will be about education, at least early learning education here in Washington State. We want to continue to have these conversations because it is so critical for our young kids. We have Senator Claire Wilson scheduled on. I'm hoping we have one other senator who's chairing that committee. So stay tuned for that. But we continue this journey of progress and prosperity for Black America. So thank you all for joining this evening, and I'll look forward to seeing you next week.
Half that up in Saks, I favor Black businesses. Assuming I'm rooting for everybody that's Black. Yeah. Yeah. Assuming I'm rooting for everybody that's Black. Yo.